one of the things that gets pointed out when you learn about bioidentical hormone replacement is that nature would not have put a receptor there if it didn't have a purpose. Nature is ultimately efficient, and it has no receptors without purpose. There are no vestigial receptors or no leftover receptors, no appendix receptors. If there's a receptor there, it's doing a job. And there are lots of progesterone receptors throughout the brain. And we know in treating head injury, post-head injury patients, that progesterone makes a big difference in reducing inflammation and helping the brain heal. If you think about the acute incident of a concussive injury and the inflammation that that causes and how helpful progesterone is in mitigating that, and then you think about the gradual rise of inflammation in the female brain postmenopausal, you think about how valuable progesterone would be for that brain. And as it turns out, progesterone, given in its natural form, whether immediate or slow release, helps women sleep. It helps women feel better when they wake up. It helps women think more clearly and be more attentive, all of which has to do with the reduction of inflammation and also the facilitation of efficiency. Remember earlier we talked about hormones being managers, and progesterone helps to manage the synaptic connections and nerve transmission that interrelate the different segments of the brain that give us awareness and purpose. Progesterone replacement, if you look back in the 1990s, bioidentical progesterone was being used for PMS and PMDD, and it was being used very successfully. We then later found out that it was because it improves and potentiates allopregnanolone. I think that the secret benefits of allopregnanolone have not yet been fully revealed, and I think that allopregnanolone is going to become an even more important molecule as we go forward in terms of dealing with age-related cognitive loss as well as dementia.